Hello, this is Sumit Dahiya and I support your dreams. Today I am going to tell you about the interview questions and answer of HL7 and HIPAA about the US healthcare. Here we start. What is the full form of HL7? Full form of HL7 is Health Level 7. Health Level 7 or HL7 refers to a set of international standards for transfer of clinical and administrative data between software applications used by various healthcare providers. These standards focus on the application layer, which is Layer 7 in the HIPAA model. What is HL7 interface? A HL7 interface engine is an interface or integration engine built specifically for the healthcare industry. It connects legacy systems by using a standard messaging protocol, these standards and the most commonly used throughout the world. What is HL7 message? HL7 messages are used to transfer electronic data between disparate healthcare systems. Each HL7 message sends information about a particular event such as a patient admission. This section describes the contents of an HL7 message and how an HL7 message is organized. May 13, 2008. What does FIR stand for? FIR is the latest standard to be developed under the HL7 organization. Pronounced FIRE, FIR stands for Fast Healthcare Interoperability Resources. I think it's the most interesting standard to have come out of HL7 since the original HL7 protocol. What is a CDA document? The HL7 Clinical Document Architecture, CDA, is a XML-based markup standard intended to specify the encoding, structure and semantics of clinical documents for exchange. CDA is an ANSI-certified standard from Health Level 7 International, HL7.org. What is an ADT feed? In the HL7 standards world, ADT, or order messages, and ORM, results messages, are the most common HL7 messages. Of those three, ADT messages are the most commonly used. ADT stand for admissions, discharges, and transfers. There are many different types of ADT message types, such as, registering a patient. July 18, 2008. What is ORU stands for in ORU? HL7 terms. In the HL7 standard, an observation result, ORU, is usually in response to an order and provides clinical observations. In HL7 messaging, ORU messages provide structured patient-oriented clinical data between systems, for example, EKG results to a physician's office. What is LOIN codes used for? Logical Observation Identifiers Names and Codes, LOINC, is a database and universal standard for identifying medical laboratory observations. It was developed and is maintained by the Regenstrief Institute, 1A, U.S. nonprofit medical research organization, in 1994. What is CCDA? Clinical Document Architecture, CDA, is a markup standard created by Health Level 7 International, HL7, that defines the structure of discharge summaries, progress notes and other medical records. What is an open EHR? OpenEHR is an open standard specification in health informatics that describes the management and storage, retrieval and exchange of health data in electronic health records, EHRs. In OpenEHR, all health data for a person is stored in a one-lifetime, vendor-independent, person-centered EHR. What is the Continuity of Care document? The Continuity of Care document, CCD, is a joint effort of HL7 International and ASTM. CCD fosters interoperability of clinical data by allowing physicians to send electronic medical information to other providers without loss of meaning and enabling improvement of patient care. What is the CCDA? Consolidated Clinical Document Architecture, CCDA, is a complete architecture used to create documents and template methodologies for those documents. Primary function of the CCDA is to standardize the content and structure for clinical care summaries. What is CDA Confidential Disclosure Agreement? A non-disclosure agreement, NDA, also known as a confidentiality agreement CA, confidential disclosure agreement, CDA, proprietary information agreement, PIA, or secrecy agreement, SA, is a legal contract between at least two parties that outlines confidential material, knowledge, or information that the parties. What is the meaning of CDA? CDA information. What does CDA stand for? CDA stands for Child Development Associate. Who gives the CDA credential? The Council for Early Childhood Professional Recognition, located in Washington, D.C., administers the assessment and credentialing of child care providers. What is DICOM? Digital Imaging and Communications in Medicine. DICOM is a standard for handling, storing, printing, and transmitting information in medical imaging. It includes a file format definition and a network communications protocol. What is I standard? I is an initiative by healthcare professionals and industry to improve the way computer systems and healthcare share information. I promotes the coordinated use of established standards such as DICOM and HL7 to address specific clinical needs in support of optimal patient care. What is ADT in healthcare? HL7 ADT messages keep patient demographic and visit information synchronized across healthcare systems. ADT is the most commonly used HL7 messaging type, with most clinical applications enabled to receive key ADT messages. October 5, 2006. What is cold feeding? Cold feeding is scanning documents created on paper and making their images available for viewing on a computer monitor, computer output to Laserdisc. What is an OR message? HL7 terms. In the HL7 standard, an observation result, ORU, is usually in response to an order and provides clinical observations. In HL7 messaging, OR messages provide structured patient-oriented clinical data between systems, for example, EKG results to a physician's office. What is ORM stands for in HL7? In the HL7 standards world, ADT, ORU, order messages, and ORM, results messages, are the most common HL7 messages. Of those three, ADT messages are the most commonly used. ADT stand for admissions, discharges, and transfers. What is SNOME-CT? SNOME-CT, systematized nomenclature of medicine clinical terms, is a comprehensive clinical terminology, originally created by the College of American Pathologists, CAP, and, as of April 2007, owned, maintained, and distributed by the International Health Terminology Standards Development Organization, ITSDO, a NOT. What is a SNOME code? The primary purpose of SNOME-CT is to encode the meanings that are used in health information and to support the effective clinical recording of data with the aim of improving patient care. SNOME-CT provides the core general terminology for electronic health records. What is C32? A C32 is a type of continuity of care document, CCD, which focuses on the patient's summary information. The data is extracted from RPMs. The demographic data and patient identity are confirmed through the MPI. Then the C32 document is put into the registry and repository. What an OpenEMR? OpenEMR is medical practice management software which also supports electronic medical records, EMR. It is ONC Complete Ambulatory EHR certified and it features fully integrated electronic medical records, practice management for a medical practice, scheduling, and electronic billing. What is electronic health record? An electronic health record, EHR, is an electronic version of a patient's medical history, that is maintained by the provider over time, and may include all of the key administrative clinical data relevant to that person's care under a particular provider, including demographics, progress notes, problems, medications. What is CCR document? A CCR can also be exported to other formats, such as PDF or Office Open XML, Microsoft Word 2007 format. The Continuity of Care Document, CCD, is an HL7 CDA implementation of the Continuity of Care Record, CCR. What is CCD stands for? CCD stands for Continuity of Care Document and is based on the HL7 CDA architecture, said Burrell. CDA, or Clinical Document Architecture, is a document standard, governed by the HL7 organization. 1. What is HL7? Interoperability, or the back-and-forth exchange of patient health data among different organizations, is seen as the ultimate IT goal of the modern healthcare system. When discussing meaningful use, HIpaa and the Affordable Care Act, said Bruhl. One of the major challenges to healthcare interoperability is defining common standards for structured content of healthcare data and the transport of that data between different systems, created by different vendors, he said. Creating consensus behind a common healthcare standard is the mission of HL7, which was founded in 1987. The HL7 standard was created and has since become widely adopted by vendors worldwide to define content, said Bruhl. 2. What is the difference between HL7 version 2 and HL7 version 3? According to Bruhl, HL7 version 3, v3, isn't all that similar to HL7 version 2, v2. While v2 provides a negotiated framework for developers to easily use and adapt, v3 was targeted to be a stricter standard that aimed to eliminate variances, in an effort to improve interoperability between all users of the standard, he said. From a technical standpoint, he added, typical HL7 structure data uses pipes, vertical bar, and hats, while HL7 v3 is based on XML. Due to a large embedded v2 base, adoption of v3 is still very slow in the US, with more than 90% of systems and applications still using some form of HL7 v2, he said. HL7 v3 includes both messages and documents, he added, with v3 documents being called CDA, or Clinical Document Architecture. While a move to v3 message doesn't appear to be on the horizon, CDA documents have been adopted in meaningful use standards for both stages 1 and 2, Bruhl said. 3. What are Z-segments? Z-segments contain clinical or patient data that may not be a good fit for other segments of the HL7 v2 standard, said Bruhl. Essentially, it's used as the catch-all for data that doesn't fit into the HL7 standard message definitions. Z-segments can be inserted into any message. They're also one reason why the HL7 standard is sometimes called a flexible standard, he added. There literally are no limits to the data contained in a Z-segment, or in the number of Z-segments included in an HL7 message, said Bruhl. Continued on the next page. 4. What is an ADT message? The most commonly used HL7 v2 messaging type is ADT, or Admit-Discharge Transfer Messages, which record patient demographic and visit information. They're typically initiated by the Hospital Information Systems, HIS, or a registration application, said Bruhl. They also inform other connected systems about key patient information, such as when the patient has been admitted, discharged, transferred, or if the patient's demographic data has changed, such as their name, insurance, or next of kin, he said. 5. What is an ORM message? According to Bruhl, ORM messages are general order messages that contain any request for clinical materials such as, for example, 500 milliliters of saline, or services like an EKG study. Order messages are usually associated with a particular patient, but they can also be used by a department to order materials, he said. The transmission of ORM messages occurs between the application placing the order, and the clinical application filling the order. Typically, he added, the caregiver enters an order in the HIS application. This then acts as the placer application. The system that receives the message from the HIS application is typically considered the filler of the order, Bruhl said. 6. What is an OR message? ORUs, or observational report messages, are usually the result message from the filler application of the ORM message, said Bruhl. They typically contain information and analysis from medical procedures, like test results from the lab or the radiology department. OR messages also can be used for linking orders and results to clinical trials, he added. 7. What are HL7 separator characters? Separator characters in HL7 are also known as message delimiters or special encoding characters, said Bruhl. The separator characters are defined at the beginning of the HL7 message in the MSH segment. An example MSH segment with the HL7 recommended separator characters would begin, MSH vertical bar caret tilde / and, with the separator characters defined as field separator, aka pipe, component separator, aka hat, and subcomponent separator, field repeat separator, escape character. While the above separator characters are recommended, the separator character for segments, ASCII 13 or hex 0D, is not negotiable, added Bruhl. 8. What are HL7 escape sequences? HL7 defined character sequences to represent special characters not otherwise permitted in HL7 messages, said Bruhl. These sequences begin and end with the message's escape character usually and contain an identifying character followed by 0 or more characters. The most common use of these escape sequences, he said, is the escape the HL7 characters defined above. HL7 Question 1. Can I insert a Z segment anywhere in the HL7 message or can I only place the Z segment at the end? HL7 Answer. You can place the Z segment anywhere in the HL7 message. There is no rule in HL7 that dictates where a Z segment should be located in a message. One popular approach is to insert the Z segment in the message so it is grouped with similar information contained in the message. For example, if you are storing insurance-specific data, you may want to create a ZIN segment and place it in the insurance group in your message directly after the IN3 segment. Another approach is to place any Z segments at the end of your message, so systems that are configured to parse the standard HL7 format can read the segments in the order they expect them without making modifications to their configuration. Subsequently, if they need the data in the Z segment, they can modify their parser to extract the data. HL7 Question 2. In our customer's interface specification, if they have not defined a Z segment yet they send some Z segments, should I throw an HL7 conformance error or not? HL7 Answer. You should be prepared to accept the Z segment in the HL7 message. It has unfortunately very common to build your processing based on a system's specifications and then find differences in the format once you receive actual HL7 messages. We have written a white paper on HL7 conformance checking, if you need additional information. When you are in the testing and development phase of your healthcare integration implementation, you should ensure you can parse the structure that you will be receiving. If you are not interested in the data in the Z segment, you may not reference it in your processing, but you still need to take into account that the format of the message will include it. If the Z segment is at the end of the message, then you may not have to account for it since you can parse the complete HL7 message without addressing the Z segment. How you address this issue will depend on the application you use to parse the HL7 messages. If there are more questions about working with HL7Z segments, please post a reply. We welcome the questions and feedback. Tell me about a time when you encountered a difficult customer, and what you did about it. With a question like this, an interviewer is looking for an interaction you have had with clinical staff. In healthcare IT, there is always some level of friction between clinical staff and the technology they use. If you have any experience where you helped a physician or nurse with technology, anticipate how you can use that experience to respond to this kind of question. If you don't have an example of working with clinical staff, find another customer service experience to tell about, then pivot your response to let the interviewer know that you are prepared to deal with clinicians who struggle with technology. How would you play a role in protecting patient safety at this organization? If you are applying for a job in a hospital, there is a good chance you will get a question like this. Of course, your answer will vary depending on the job you are applying for, but you can always find some kind of answer. In a technical role, you might bring up points like these. Being diligent to patch critical software when alerts are released. Setting policy and safeguards for the use of flash drives. Setting policy for how long workstations sit before automatically securing. If you are applying for a more clinical or operational type of position, you might answer along these lines. Gaining extra training and becoming a super user of key software. Looking for gaps in the workflow when patients transfer from one area to another. Helping other clinical staff to deal with the frustrations of technology. Tell me about a time when you made a mistake, and what you learned from it. This is a big one in that our habits tell us to only show our best side in an interview. However, remember the folks sitting on the other side of the table are just like you, and we all appreciate honesty, transparency, and a willingness to admit we make mistakes. If you stumble on a question like this by not remembering when you made a mistake, you may appear either insincere or come off as too cautious. What is something you like about your current position? We're usually prepared for questions on why we want to leave our current position. If you fill 10 minutes of reasons you want to make a change, but can't find anything good about your current job, that may be a red flag to interviewers. What do you know about this organization? While it has common sense to have done homework on the organization you are applying to, it seems to carry extra importance in healthcare organizations, especially hospitals. Most hospitals have a rich history and some unique stories on how they either were founded or grew into what they are now. You will make an unforgettable impression if your interviewers leave the interview feeling great about where they work. How would your current team members describe you? This is one of the hardest questions I've seen. It forces us to think not just about how we view ourselves, but how we think others view us. The best way to prepare for this question is to ask it of a trusted coworker in your current position and come up with some middle ground answers on your better qualities. Do you have any questions for us? Some candidates think so much about answering questions, they forget to consider what they would like to ask a potential employer. You want to present as being intellectually engaged, so you might ask questions like what do you like about working here? Or how would you describe this organization's culture? 1. What happens when HL7 accelerator is installed? 2. What does HL72's common project contains? 3. What does HL7231 common project contains? 4. Is it mandatory to configure party for HL7? 5. Is it required to specify schema per pipeline? 6. What consideration is to be taken while dealing with MSH entries? 7. When does DASA generate acknowledgements? 8. Why is it required to have party configured? 9. HL7 accelerator runs in which mode? 10. Can we override values in the MSH segment of the outgoing message? 11. Can we alter the namespace in the MSH schema? 12. What is difference between HL72's receive and HL7's receive? 13. What are the acknowledgement types in HL7? HIPAA, the basics. What is HIPAA? HIPAA created mandatory standards for electronic payment-related transactions between healthcare providers and health plans, and it protects the privacy and security of health information in the hands of covered entities. What does HIPAA protect? The HIPAA privacy regulation protects individually identifiable health information, also known as protected health information, PHI, in the hands of covered entities and their contractors. The identified information is not protected. Identifiable health information is only protected if a health provider generates it. If I decide to track my blood pressure using a website that charts my input, it is not covered under HIPAA laws because it is user-generated. PHI can only be disclosed for one of the following reasons. To the individual. For treatment, payment or healthcare operations. For governmental and other specified public interest purposes. Pursuant to individual written authorization. Business associates, as related to HIPAA regulations, are contractors that help covered entities with payment or operations using protected health information. Before accessing PHI, the covered entities must obtain a confidentiality agreement from the business associates. This agreement must cover protecting the confidentiality and security of the information, restricting its use to the purposes of the contract, reporting breaches of privacy and security, returning or destroying the information at the end of the contract. HIPAA Bill of Rights. Patients can almost always access their health information. Wait, why almost always? If it is determined that it would be harmful to the patient or someone else, covered entities do not have to disclose an individual's health information. So what rights does the individual have? Individuals have the right to request additional restrictions on the use of their health information. They have the right to amend their health information, unless the provider or health plan determines it is accurate, and they have the right to request confidential communications from their healthcare providers and health plans. PHI can only be disclosed for one of the following reasons. To the individual. For treatment, payment or healthcare operations. For governmental and other specified public interest purposes. Pursuant to individual written authorization. Business associates, as related to HIPAA regulations, are contractors that help covered entities with payment or operations using protected health information. Before accessing PHI, the covered entities must obtain a confidentiality agreement from the business associates. This agreement must cover protecting the confidentiality and security of the information, restricting its use to the purposes of the contract, reporting breaches of privacy and security, returning or destroying the information at the end of the contract. HIPAA Bill of Rights. Patients can almost always access their health information. Wait, why almost always? If it is determined that it would be harmful to the patient or someone else, covered entities do not have to disclose an individual's health information. So what rights does the individual have? Individuals have the right to request additional restrictions on the use of their health information. They have the right to amend their health information, unless the provider or health plan determines it is accurate, and they have the right to request confidential communications from their healthcare providers and health plans. ICD-9 and ICD-10 code description about this difference between CPT code ambulatory, inpatient, outpatient, U.S. healthcare video, HL7 video, HIPAA Act Study S. What is the full form of HIPAA? The Health Insurance Portability and Accountability Act of 1996, HIPAA, Pub.L. 104-191, 110 Stat. 1936, enacted August 21, 1996, was enacted by the United States Congress and signed by President Bill Clinton in 1996. What is the HIPAA? HIPAA, Health Insurance Portability and Accountability Act of 1996, is United States legislation that provides data privacy and security provisions for safeguarding medical information. April 24, 2015. What are the requirements of HIPAA? HIPAA, the Health Insurance Portability and Accountability Act, sets the standard for protecting sensitive patient data. Any company that deals with protected health information, PHI, must ensure that all the required physical, network, and process security measures are in place and followed. What is HIPAA enforcement? HIPAA enforcement. HHS Office for Civil Rights is responsible for enforcing the privacy and security rules. Enforcement of the privacy rule began April 14, 2003 for most HIPAA-covered entities. What is HIPAA security rules and why it is important? Whereas the HIPAA privacy rule deals with protected health information, PHI, in general, the HIPAA security rule, SR, deals with electronic protected health information, EPI, which is essentially a subset of what the HIPAA privacy rule encompasses. When was HIPAA passed? The Health Insurance Portability and Accountability Act of 1996, HIPAA, Pub.L. 104-191, 110 Stat. 1936, enacted August 21, 1996, was enacted by the United States Congress and signed by President Bill Clinton in 1996. What is HIPAA form? HIPAA Privacy Authorization Form. Authorization for use or disclosure of protected health information. Required by the Health Insurance Portability and Accountability Act, 45 CFR Parts 160 and 164, 1. Authorization for release of PHI covering the period of health care, Check 1, A. What does minimum necessary means? Minimum necessary is the process that is defined in the HIPAA regulations. When using or disclosing protected health information or when requesting protected health information from another covered entity, a covered entity must make reasonable efforts to limit protected health information to the minimum necessary to. What is the minimum necessary standard? When minimum necessary standard applies, 1. A covered entity must make reasonable efforts to limit the scope of the PHI it uses, discloses or requests to the minimum necessary to accomplish the intended purpose of the use, disclosure, or request. 2. The minimum necessary standard applies in 3 circumstances. April 20, 2012. Who enforces HIPAA law? The Office of E-Health Standards and Services within the Centers for Medicare and Medicaid Services, CMS, enforces the transactions and code sets and national identifiers, employer and provider identifiers, regulations of the Health Insurance Portability and Accountability Act, HIPAA. What is the OCR? The Office for Civil Rights, OCR, is an organization within the U.S. Department of Health and Human Services, HHS. OCR works closely with both doctors and patients to ensure that every patient knows their rights and privacies concerning personal health information and medical treatment options. Why is the confidentiality of a patient important? Patient confidentiality is one of the most important pillars of medicine. Protecting the private details of a patient is not just a matter of moral respect. It is essential in retaining the important bond of trust between the doctor and the individual. February 23, 2011. What is the security rule? The security rule. The HIPAA security rule establishes national standards to protect individuals' electronic personal health information that is created, received, used, or maintained by a covered entity. What is the HIPAA law? The Health Insurance Portability and Accountability Act of 1996, HIPAA, Public Law 104-191, was enacted on August 21, 1996. Sections 261 through 264 of HIPAA require the Secretary of HHS to publicize standards for the electronic exchange, privacy and security of health information. December 28, 2000. What must the Notice of Private Practices inform patients of? The Health Insurance Portability and Accountability Act of 1996, HIPAA, requires each patient is provided with a Notice of Privacy Practices, NPP, to the healthcare organization's patients. The goal of the NPP is to inform patients, 1. The covered entity's duties with respect to a patient's PHI. What is the Notice of Privacy Practices? The HIPAA privacy rule requires health plans and covered healthcare providers to develop and distribute a notice that provides a clear, user-friendly explanation of individuals' rights with respect to their personal health information and the privacy practices of health plans and healthcare providers. What is the minimum necessary rule? The minimum necessary rule requires that DMH, its offices, facilities, programs and workforce members, when using, disclosing, or requesting protected health information, PHI, must make reasonable efforts to limit PHI to the minimum amount necessary to accomplish the intended purpose of the use, disclosure or request. April 14, 2003. What does the minimum necessary standard mean and when does it apply? When using or disclosing protected health information, PHI, or when requesting PHI from others, HIPAA's privacy rule requires that a covered entity make reasonable efforts to limit itself to the minimum necessary to accomplish the intended purpose of the use, disclosure, or request. What does HIPAA minimum necessary standard require of healthcare workers? The privacy rule generally requires covered entities to take reasonable steps to limit the use or disclosure of, and requests for, protected health information to the minimum necessary to accomplish the intended purpose. The minimum necessary standard does not apply to the following. Who is covered by HIPAA privacy law? The privacy rule, as well as all the administrative simplification rules, apply to health plans, healthcare clearinghouses, and to any healthcare provider who transmits health information in electronic form in connection with transactions for which the Secretary of HHS has adopted standards under HIPAA, the covered What is Omnibus Rule? The HIPAA Omnibus Rule, Health Insurance Portability and Accountability Act of 1996 Omnibus Rule, and a Health Information Technology, HIT, context, is a rule enacted by the U.S. Department of Health and Human Services Office of Civil Rights, OCR, to modify the Health Insurance Portability and Accountability Act. What is limited data set? A limited data set is a limited set of identifiable patient information as defined in the privacy regulations issued under the Health Insurance Portability and Accountability Act, better known as HIPAA. Who oversee HIPAA? The Office of Civil Rights, OCR, within the U.S. Department of HHS oversees and enforces the Privacy and Security Rule. HIPAA guarantees individuals the right to access and request amendment of their protected health information and to request an accounting of disclosures of PHI. Which federal agency is responsible for developing regulations to support the requirement of HIPAA? Which federal agency is responsible for enforcing the HIPAA standards? The Department of Health and Human Services, HHS, Office for Civil Rights, OCR, is responsible for enforcing the privacy rule and the security rule. How does OCR software work? Optical character recognition, or OCR, is a method of converting a scanned image into text. When a page is scanned, it is typically stored as a bitmapped file in TIFF format. When the image is displayed on the screen, we can read it. But to the computer, it is just a series of black and white dots. What is the meaning cache rate? The official cache rate, OCR, is the term used in Australia and New Zealand for the bank rate and is the rate of interest which the central bank charges on overnight loans to commercial banks. Why do we maintain confidentiality? Confidentiality is important to maintain privacy, security and trust in personal and professional relationships. Breaking the rules of confidentiality by releasing private information to the wrong entity can cause discord, broken trust and even lawsuits between parties. Why is it important to have HIPAA? Why HIPAA is so important to you? Health Insurance Portability and Accountability Act of 1996, HIPAA, is the law enacted to protect your privacy, allow access to your medical records and designate who can speak on your behalf. A very important aspect of HIPAA law is the right for you to designate who can speak for you. August 16, 2010. Who must comply with the security rule? All HIPAA-covered entities and business associates of covered entities must comply with the security rule requirements. Find out if you are a covered entity. The security rule applies only to electronic protected health information, (IFI). What is a technical safeguard? According to the HIPAA security rule, technical safeguards are the technology and the policy and procedures for its use that protect electronic protected health information and control access to it. What does it mean to be HIPAA certified? HIPAA certified does not mean you are compliant. It does not mean that you are compliant, but that you have been taught the terms of the Health Insurance Portability and Accountability Act and also the knowledge needed to apply these to your organization. February 19, 2015. What does the term HIPAA stand for? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996 and its purpose is to provide healthcare coverage continuity, ensure greater accountability and simplify administrative functions within the healthcare industry. Why was HIPAA implemented? HIPAA was enacted as a broad congressional attempt at healthcare reform. It was initially introduced in Congress as the Kennedy-Kassebaum Bill. The Landmark Act was passed in 1996 with two objectives. One was to ensure that individuals would be able to maintain their health insurance between jobs. What is HIPAA law? The Health Insurance Portability and Accountability Act of 1996, HIPAA, Public Law 104-191, was enacted on August 21, 1996. Sections 261 through 264 of HIPAA require the Secretary of HHS to publicize standards for the electronic exchange, privacy and security of health information. December 28, 2000. What is the definition of HIPAA law? HIPAA, acronym that stands for the Health Insurance Portability and Accountability Act, 1A, U.S. law designed to provide privacy standards to protect patients' medical records and other health information provided to health plans, doctors, hospitals and other healthcare providers. April 14, 2003. Why was HIPAA law enacted? HIPAA was enacted as a broad congressional attempt at healthcare reform. It was initially introduced in Congress as the Kennedy-Kassebaum Bill. The Landmark Act was passed in 1996 with two objectives. One was to ensure that individuals would be able to maintain their health insurance between jobs. What does it mean to be HIPAA certified? HIPAA certified does not mean you are compliant. It does not mean that you are compliant, but that you have been taught the terms of the Health Insurance Portability and Accountability Act and also the knowledge needed to apply these to your organization. February 19, 2015. Why was HIPAA Act created? The Health Insurance Portability and Accountability Act, HIPAA, was developed in 1996 and became part of the Social Security Act. The primary purpose of the HIPAA rules is to protect healthcare coverage for individuals who lose or change their jobs. What is main goal of HIPAA? HIPAA is the Federal Health Insurance Portability and Accountability Act of 1996. The primary goal of the law is to make it easier for people to keep health insurance, protect the confidentiality and security of healthcare information and help the healthcare industry control administrative costs. Kindly like it, share it and subscribe my channel. This is Sumit.